Hello, my name is Dr. David Dubin. I'm here to talk about something most of you have never even heard of. It's called LENS, which stands for Low Energy Neurofeedback System. It really is quite extraordinary. I used to be an emergency room physician and now have switched careers to doing LENS full time because I have found it so extraordinary. So it treats a wide range of conditions, including anxiety, a whole range of anxiety from panic attacks to PTSD. It also treats depression. It treats obsessive compulsive disorder. It treats ADD, and it treats traumatic brain injury. Now, how does it treat such a wide range of conditions? Because it optimizes brain function. How it works. We have tiny sensor that we go on the skull, that goes on the scalp, and it tracks brain waves. And it comes back to a computer. The computer does calculations, and at a given moment, it sends back an extremely tiny signal back to the brain that for 100th of a second. And when I say tiny, that signal is so small, it's 1,000 times less than a cell phone, and it goes for maybe 100th of a second. And yet it has dramatic results. When I first heard about LENS, I actually had a hard time believing that this could work. And it's only until I had direct experience and began treating people with LENS that I believed how extraordinary it is. So that tiny signal goes back to the brain. It's out of phase with the brain waves, and it causes some tiny fluctuation. And as a result of that tiny fluctuation, the brain's able to free itself up from frozen, stuck, dysfunctional patterns that it's gotten itself into. And so it's not about training the brain. This is really disentraining the brain from stuck, frozen, dysfunctional patterns. Healthy patterns are flexible. They stay fine. But these frozen patterns are able to free themselves, and the brain is then able to make use of it however it needs to, and the brain optimizes itself. So if you have ADD, your ADD starts to improve. If you have anxiety, anxiety starts to improve. And if you have both ADD and anxiety, it treats them both at the same time, because it's not diagnosis-based. It optimizes brain function. And it's really quite extraordinary. For anxiety, it treats everything from chronic anxiety to panic attacks to phobias to full-blown post-traumatic stress disorder. It's very effective. I'm amazingly successful with 90% of the people I treat for anxiety with any of the conditions I just mentioned. Anxiety is also a driving factor for a lot of other problems. For OCD, obsessive compulsive disorder, anxiety drives a lot of it. So as anxiety diminishes, OCD also improves. It's the same with anger outbursts. It's the same with trichotillomania or hair pulling. They're all part of anxiety. Anxiety is a key component. And the improvements seen with anxiety are really dramatic and really fast. In addition to being successful, literally with 90% of my patients, almost all of them begin experiencing the change within the first or second session. And initial changes are temporary. And so we keep doing subsequent sessions, and with subsequent sessions, each one, the effect lasts longer. And also the floor rises, so that even as the effect is wearing off, as the person comes back to a state better off than he started. So anxiety, and then depression. Depression, successful about 2/3 of the time. People start feeling lighter. They begin to get their optimism back. They feel more energized, and they get on with their lives. Even if you're on antidepressants, people are frequently able to get off antidepressants doing this. And being on antidepressants isn't an obstacle. Being on any medication is not an obstacle to doing LENS. In addition, this is effective for ADD. Probably 80% of people we treat gain improvement with ADD. It's as effective as Ritalin with ADD. But one of the things that's so dramatic and amazing about LENS is that once someone has treated with ADD, for example, the effects are enduring. So treatment is then done. Not like with medication, where as soon as you stop taking medication, you're immediately back to where you started. With this, amazingly enough, the benefits persist. It's easier for the brain to function well and to maintain good functioning than it is to actually struggle with dysfunction. So once the brain is able to achieve an effective functional state, it wants to keep that. This is also very beneficial for traumatic brain injury. In fact, it is essentially the only real treatment for traumatic brain injury. Post-concussive syndromes, I see all the time, people with unable to concentrate the way they could before, multitask, fatigue, all these issues. While outwardly a person may seem fine, after a concussion or some kind of mild, moderate brain injury, they're not able to function well at all. This responds dramatically to neurofeedback in general, and to lens in particular. Usually find dramatically, really significant change in 6 to 8 sessions. And again, once the person improves, these changes are enduring. It's more problematic with, and not so easy with really much more dramatic head injuries, but this is the only thing that can significantly work. So these football players should be doing lens neurofeedback. All these high school athletes should be doing lens neurofeedback. All these vets who've had traumatic brain injury coming back from Iraq should be doing lens neurofeedback. It's also extremely easy on the patient to do. The patient doesn't have to do anything. In a subsequent video, I'll show a demonstration, and you'll see how easy it is. So to learn more about lens and to learn more about my approach to treating patients, you're more than welcome to come to my website, which is www.thedubinclinic.com.